And I switch it to English again to introduce what we will see in a few minutes. Ask to my team, could you go to the VIP lounge, please, and silence them a little bit? This would be nice, just for us here. Okay, thanks. So I will introduce. Let me first introduce. Secondly, introduce you to our next speaker, but first introduce you to probably the most disturbing statement of this conference. There is a lady among us, and José already said, named her the first genetically edited woman in the world. She herself, she says, "I'm proud to be a GMO. I'm proud to be genetically modified." And this is probably this is something I never heard before. I don't know, you heard this, but not me. So you will see a person on this stage who is genetically modified, and not only once, but I think 10 times, is it true? 10 times genetically modified. And we are not talking about cosmetic surgery, no, we are talking about gene therapies. So she's one of the best known entrepreneurs in the field of human longevity, and today she's from Silicon Valley. She had a long trip to come here, but now she's here on this stage. Please, come on stage, Elizabeth Parrish. Hi, Liz. So great to have you. Let's sit down, okay?
Okay, let's do.
So, it's so great to have you. Let's sit down.
Let's talk about it.
Let's talk about it. I'm wondering, who are you? Are you a scientist? Are you a biohacker? Are you a businesswoman? Who are you?
I'm a mom.
Good.
That's what I recognize myself as most, but I suppose I am an entrepreneur now, but out of necessity of my son's disease that trajected me into a world of looking for curative medicine for children, and then finding that with the same genes that could help children, we can help aging people live longer, and it's a lot faster route of using consenting adults to get there to help cure childhood disease.
Wow. The first time we met, it was back in 2016.
That's right.
Yeah, we looked it up. And back then you had already two of the, you tested on your body two of the gene therapies. Now you have 10. So a very stupid question from a kind of an outsider. How many gene therapies a person should get?
Well, you know, in the future, we're working on new modalities to deliver gene therapy, and so you'll actually take less gene therapies, but get more genes.
Yeah.
And so optimally, probably you'll get 5 or 10, but in total, you'll get a multitude of genes that will help your body live longer and healthier.
Okay, to understand your story and the thing you are talking about, I think for some of us, it's important to ask some basic questions. Sure. What is a gene therapy? So is it I'm taking a pill or an injection? What is it? How long does it take and so on? Yeah,
so a gene therapy is given by injection, and we use what are called vectors in order to deliver them to the nucleus of your cell. That's how we get long-term expression. So when I talk about doing gene therapies, one gene therapy could last you 10, 15 years or your entire life, because the goal is to get it into the nucleus of the cell. So we use a very specific technology to do that. But what it looks like to you is just a liquid serum. Mm-hmm. We specialize in neurodegenerative diseases, organs, and whole body therapies. In many cases, you would just take an IV and you would sit for 20 minutes and then you would be done. But if you had kidney failure, we'd put you under sedation and do image-guided radiotherapy to the location and then inject the gene therapy there. With neurodegenerative disease, we do intranasal injections, and then we're working with special scientists to actually direct it to the hippocampus and other areas of the brain. So we're working with university specialists and everything now to make a better gene therapy.
And how you do... how you feel. Very stupid. Sorry for the simplicity of my questions, but how do you feel the day after?
Oh, great.
Really?
I mean, yeah.
So it's not you laying down and you.
Oh, no, you're not convalescing. So actually, let's let him do that. You're actually feeling fine and, oops, we lost sound.
Yeah. What is he doing there?
Not gene therapy.
Not gene therapy.
He's fixing me up. He's making me beautiful.
You.
So the next day, you're back to activities, and you're basically under observation for a few days. You're eating only cooked food, nothing that's just raw vegetables, because you're under some mild immune suppression. And slowly you're getting back to your just regular life.
Yeah. And how many people in the world experience this?
Well, we'll talk about that a little bit in the presentation, because now hundreds of people have gone through gene therapy. And actually, you know, to be honest, other people had taken gene therapy before me, but for monogenic diseases, so very specific diseases. I was just the first one to teach basically how to do it for biological aging.
I'm really curious. What are the news?
The genetically modified walk amongst you.
Yeah, okay. So I don't want to waste your time. This is your stage, and after this we continue our nice chat.
Okay, so gene therapy. So, you know, gene therapy is the insertion, the editing, or the deletion of genes in your human genome. And in some case, we actually create an episome, and that's when we don't affect the human genome. And that's what we specialize in. We just want to put genes into the nucleus of your cells and have long-term expression of those genes. So you're all comprised of your genes, and they vastly basically express in your phenotype, the color of your eyes, how tall you are, and various other attributes. And it's because they code for proteins, and those proteins change you. So when gene therapy started in the early 1960s, the idea and the hypothesis was to cure disease very simply by adding genes that were dysfunctional. The original ones were dysfunctional in the humans, but adding a healthy copy, and that has worked. But I want to walk you through history, because you might think that gene therapy sounds like a very big concept, and you would wonder why we would use such a powerful technology in people, especially to treat something like biological aging. But when we look back to the 1600s, they might have wondered why we would want to cure infectious disease. Most of the population actually died of infectious disease, and by looking at the earliest written records, only about 1% of people died of biological aging. So they really didn't have any identification of what that was. It's just some people lived to grow to be very old. Most didn't. But because scientists started to take that very seriously, by the 1900s, early 1900s, only 50% of the population died of infectious disease. Wow. So that's a big improvement, but that is not very good odds. So that's literally flipping a coin. 50-50, I'm going to die of an infectious disease, or I might live to get old. So we decided in science that that wasn't enough. So what I want to put into your head here is that all medicine is longevity medicine. We have decided together to do this, and now we're just taking it to the next level. We might have broke a few rules doing that, but we did it legally, just breaking a few rules. So by the time we get to 2010, guess what? Infectious disease is so rare. It's 3% of the population, and it's so rare that when we have a pandemic, the whole world freaks out. If you know someone who died of COVID-19, it was considered a major tragedy, even though if you died naturally, that's pretty much how most people would have died historically. Around 35 would have been about it for most people. But taking things seriously actually changes this graph enormously. And so if we look at what it looked kind of like to live in the 1600s, it probably looked like this over here. You went along, you were alive, and then you were dead. You died very quickly of these diseases. Now, today, what medicine looks like in today's regular medical system is that you're going along and you have a heart attack and maybe you get a stent and you're brought back up, but you're brought back up to a natural death curve. So we save your life, but we don't cure your life, right, from the disease. And so when you zoom out on that, this is today's long fade to death. And vastly, it is known how long we will live as a species. One of the problems here is not only that this is a terrorizing problem, that we all know that we're going to die of some hideous diseases, but it's actually not very economically sound. So if we look at earning versus eating, we see that most people actually don't come above the consumption level until they're about 25 years old. And all of us with kids know that. We put a lot of energy into them, a lot of financing, a lot of food into these bodies to grow them up. And then finally, they're above the line. They're actually earning enough to exist on the planet. But then we fall back down below that line, and these aging-associated diseases are actually crushing our economic systems. Countries like China are now the leaders in gene therapy and advanced regenerative medicine because they have a looming threshold of massive medical ailments. They have an aging population over the age of 65 that's bigger than the entire population of the United States. So I think that this probably resonates really well with a lot of people here. I eat right, I exercise, I don't drink or smoke, but I'm still going to die someday. That changes everything. So if somebody said to you, you've done everything right, but you're doomed. I mean, we would say, maybe I should just smoke and drink. But the data shows us otherwise. Now, it's very hard to probably get people off of alcohol, harder than cigarettes, and cigarettes are very difficult. But the major gain in lifespan that we see between the orange and the red line here, this is the most major gain since 1975, after we brought in immunizations, antibiotics, workplace safety. We made things as awesome as we could. The only way we could get more gains is the cessation of smoking. So, is it important what you do in your lifestyle? Absolutely. Just the cessation of smoking could add 6 years to your life. And if you're wondering if I think that biological aging is a disease, it absolutely is. I didn't bring my hallmarks of aging slide, but there are 12 hallmarks that we know happen at the cellular level that drive biological aging, and those are our targets in gene therapy. That's how we know that we can actually affect biological aging at the cellular level. But when we look at this graph right here, this is the visualization of that disease. So cellular aging is happening to you basically pretty much from conception. By the time you're born, you're down many, many base pairs in your telomeres. You're accumulating some damage, but it doesn't have much effect on your life until you hit around 45. And we've all known someone who's died what we consider young. That's called premature dying of aging-associated non-communicable diseases. But if we traject outside of there, then we see everything going up. So this year, 36 million people will die of biological aging. And we really should be furious about that. And we should be breaking a lot of rules to change that, just like we did with infectious disease. Because if you don't treat biological aging, and you continue to try to treat each one of these diseases and cure it, look, out there, who wants to cure Alzheimer's disease? Who would love to see a cure for Alzheimer's disease? Who would love to see a cure for cancer? Fantastic. Who would love to live 250 years? Less, surprisingly less. But the thing is that if you cure one of these diseases, let's say we cured cancer, you only live 2 years longer. And we know that. Because all of these diseases are actually running in parallel. It's only the one that you're diagnosed with that you care the most about. Shocking truth. So if we cure all of cancer, you live 2 to 4 years longer. If we actually cure aging, you might live for a very, very long time. So in the 1960s, again, there was a revolution in the idea that we could actually change the human genome and cure disease. And in 1984, the first paper came out that showed that we could, in fact, do it in stem cells. We could actually change the genes. And this was very huge proposition for the entire world. Things started to move very fast, but there were some stumbling blocks. So in the 1990s, gene therapy hit the mainstream, and it had its debut. And to this day, actually, one of the patients that had severe combined immune deficiency, who was cured of the disease, still speaks publicly around the world. But some patients didn't do so well because the technology was new, and there were things like integrational mutagenesis that we weren't aware of that would happen. And then a young boy died who was 19 years old of gene therapy because he actually had an immune reaction to the vector, the delivery method of the therapy, not the gene. So this took everything and basically brought it to a screeching halt. And this was the worst thing for gene therapy that could have happened because we were on the edge of cures. But luckily, scientists continued to work away at gene therapy, and a new beginning happened with something called AAV, or adeno-associated virus. We actually finally came up with a vector delivery system that was non-integrational, or at least not into sites that were oncogenic, and it could deliver genes pretty succinctly, although just small payloads. And so that was really fantastic. That gave us more excitement than ever that this field was going to take off and continue on its route to curing disease. So approvals happen. So does anyone know of any approved gene therapies? There's actually a whole bunch of them. So when people come to me, they'll often say, oh, gene therapy, that's the future medicine, that's not for today. All of these gene therapies are actually approved. They're approved by the US FDA, which is the toughest standard in the world. And I'll let you know that if you can get a gene therapy into the US FDA for investor types, it's less than 6 years to approval. 15 years for a small drug, because they have so many side effects, less than 6 years, and it will probably even be faster in the future, because we're delivering the exact gene for the exact protein that we're looking to make, and your cells make it at the cellular level. Your cells become the drug factory. If they don't like it, they will take the cell out. So there are a lot of approved gene therapies, and 2 of these are actually CRISPR for beta thalassemia and sickle cell anemia. So it's actually moving a lot faster than a lot of people thought. So how we improve the industry is we learned new ways to deliver gene therapy, and we kind of talked about that. IV is the most common for whole body expression. A lot goes to the liver and the lungs, so we got really good at intramuscular injections. So when we do something like follistatin, we actually, which is a gene that will enhance your muscles, we'll talk about in a little bit, we do it intramuscularly. Then we went into intranasal delivery. We actually have patent pendings on intranasal delivery, organ delivery, very specific organ delivery, and there's actually an approved gene therapy for children with a disease called EB. It's a rare inherited disorder in which their skin blisters off, and there's a topical gene therapy for that too. So in the world of beauty, I imagine we might see some cosmetics. This is what gene therapy looks like. I will get out of the way. This is the delivery system actually is then encoded with the genes that we're looking to deliver to the cell. It then goes through the cytoplasm. Nature has a perfect way of bringing genetic material to your cells. That's what has gotten you sick year after year and decade after decade and century after century of human development. And this is the capsid then going to the nucleus of the cell, and then it delivers the payload. It does not deliver anything that can get you sick. These are called attenuated vector delivery systems. It wouldn't be legal to use an active live vector, so we use attenuated ones. And then we deliver the gene, and the gene codes for the protein, and that changes you. So how does this work? Let's talk about some patient success stories. Here you'll see a child with muscular dystrophy. He is trying to climb some stairs. He's suffering from muscular atrophy. He's having a hard time doing that. This is him 3 months after gene therapy. Yeah. So this is a technology that can have a huge impact on a person's life. So we have repurposed this for an aging population to treat sarcopenia and metabolic disorder. This gene, amazingly, also has the ability to protect you against prostate and breast cancer, which was unexpected, and that came out in the literature review. So how did I become a GMO, and why do I think you will too? Well, I'm going to tell you that I became a GMO because my son was diagnosed with type 1 diabetes. And when I was in the hospital with him, I had already been working in regenerative medicine space for 3 years. And I asked what was available for these kids, could they do with genetics, with stem cells, with biobanking. And they were like, lady, that's experimental medicine. We don't use that in kids. And yet you're hearing coding in the hallways. Kids are actually dying. And I thought, well, this just doesn't fit in my head. How could it be that we have all of this technology and we don't use it? So I head off and I start flying around the world trying to find curative medicine for kids. And I ran into a conference about biological aging. And at that conference, I met George Church, the professor of genetics at Harvard. He eventually joined my company 2 years later as a founding member. I met a lot of people talking about biological aging and how genetically we could actually solve that. But I asked, how does this actually help kids? And it does. So all of the genes that I have taken could actually help cure children. And all of the genes that we look at to develop are actually on both sides of the end of the spectrum. They help with childhood disease and they help with aging-associated diseases. So 2 years after my son's diagnosis, we created a company called BioViva with the audacious idea that we would start translating medicine to humans that should work, that could work, and that no one else was taking a risk on. And boy, did we get it. We started the company in 2015 with me taking the first 2 gene therapies to treat biological aging. After a couple years, we realized those didn't cure all of my aging. We needed to learn to redose gene therapy. We're the first company in the world that learned how to do that. We're the first company in the world that started treating patients through investigator-initiated clinical studies. And all of that rule breaking or bending of the rules, I would say we definitely do everything legally, but we fly as far out as we possibly can to save human lives, has garnered me a lot of attention, and a lot of it is not very positive. But if you actually want to really know the truth, always reach out to the company. But we have been all over the place. National Geographic loved it. They're like, let's start genetically engineering humans now. And so it was not all bad. When we first hit the scene, there was a lot of skepticism, and now the same people who were interviewed, the same scientists that were interviewed then, actually when they're interviewed now, they're like, this company might just do it. So I'm proud to say that. So if you're out there with a big idea, definitely persevere. Don't be bothered. You have to stay strong. So when we look at longevity, what are some of the therapies that we could do that would help extend your life now? Well, we can definitely lengthen telomeres. That was a gene therapy that had never been in a human, but had been hypothesized to have a great effect on lifespan because telomere attrition, or the ends of the caps of the chromosomes, shorten As your cells divide, and our species and 24 other species, our lifespan is directly tied to the shortening of those telomeres. Do not be fooled. This is a therapy that no matter whatever other therapy you do, you have to do this if you want to break lifespan. We have a known cellular level of development and division. It's called the Hayflick limit. And you need to lengthen the telomeres in order to get past it. Also, short telomeres in your T lymphocytes leads to something called immune senescence. And there were a couple papers that came out after COVID. That was the #1 reason people died from COVID, whether they were young or old, they had immune senescence. That's why you heard a lot about the young children that died with that infectious disease, had other comorbidities, meaning they were sick with other things. And so they were sick with things that had depleted their immune system. So muscle mass increase, we can definitely do that with follistatin. And that one is in use in all sorts of clinics around the world. It's been through safety and efficacy with Nationwide Children's Hospital for Duchenne's and Becker's muscular dystrophy. So it has a really good profile, and it has no negative effects that we know of. Cognitive enhancement, we came out with Clotho, I think in 2020, for treating patients with dementia, and it enhances cognitive ability. We can protect your kidneys with both Clotho and telomerase reverse transcriptase. Mitochondrial therapy, there's a therapy gene called PGC1 alpha, and it's directly associated with mitochondrial biogenesis. So it makes it so you have more mitochondria and more robust mitochondria. And I think like one of the perspectives that you could put there is think about monkeys and humans. Monkeys have less muscle mass, but they're super, super powerful, and it's because they have mitochondrial strength behind those muscles. And so mitochondria drives a lot of your, the energy of your entire body, actually. Cardiovascular protection, there are gene therapies now. There's one that's in clinical trials in the United States. It's shown that even after heart attack, they can have almost 100% repair of the heart. Metabolic health, you increase your muscle mass, you basically put your blood glucose under control. Nerve regeneration, there are genes for that actually are rescaffolding the nerves of the body, plus Clotho actually works to protect the myelin sheaths. And epigenetic reprogramming is well described by the OSK factors. It's a gene therapy we can make in 16 weeks. And David Sinclair is showing that not only does it reprogram the cells to a young epigenetic state, it causes no increased risk of cancer. So, our studies. So in 2020, we decided that we really needed to get out and help more people. We already had one licensing company. We worked with a nonprofit, and 5 patients who had dementia with suspected Alzheimer's got access to a dual gene therapy that took about 10 minutes to administer. And what we saw, you can look up this study online, is we saw increased cognitive scores in 4 out of 5 people, and these are significant increases in cognition. The gene Clotho was well described to increase cognitive scores in mice. They're measured a bit differently within 20 minutes of injection, and we saw the same thing in humans. And then the telomerase reverse transcriptase that we also used in the study actually lengthened the telomeres in the T lymphocytes, which we didn't expect. We actually had a lot of debate whether we should look at these telomere lengths or not, because we were administering such a small amount of gene therapy, we weren't sure that it would actually have an effect on the T lymphocytes, but it in fact did, and some people got younger by their telomere age. We published a paper also on my study, and we showed that my telomere lengths, you can see here, you'll see a bump in the telomere lengths after 2020. It's because I took another gene therapy. And here you see the biological age going down. So for every year that I have lived since I did the gene therapy the first time and the subsequent times, I have gained 5.3 years on my telomere length. my telomeres are aging backwards. And will they get like super, super long? No, they won't, because your cell has actual regulation on that, and we know that now. We were the first company to start redosing gene therapies, and these are the test scores from my Clotho level. This one was after my first gene therapy in 2020, but I was tested in 2024, and it was already in the 90th percentile. And then we basically said, let's do a small dose and see what happens. And this is my scores after. So I'm like in the 95th percentile on the Clotho. So we showed that we could actually redose it and have it go up. And we had shown that in a myriad of patients as well. So when we started to talk about redosing in, let's say, 2017, we knew that we wanted to fix the AAV problem, figure out how we could actually redose that and have a therapeutic effect in patients because they would need it. But we also wanted to deliver a better gene system. And we went back to the drawing board with Rutgers University. Everything was done at Rutgers, although we own the patenting rights. And we decided to gut and attenuate something called cytomegalovirus. Sounds very scary, but it's actually very cool. It's a virus that almost everyone in here already carries. It sits quietly in your system until you get really old, and then it takes an opportunity at that point because it's trying to jump out of a sick body. Because you already have it and no immunization has ever worked against getting it out, and because it's pretty much not hazardous, unless you get very sick and old and it wants to jump, we decided let's gut this thing and make it carry healthy genes so that you never get old and sick. So it can already pack in 3 times what AAV can. We think we can get it up to 50 times what AAV can. To put this in perspective, if we put CRISPR into this system, we could CRISPR so much of your genome, it would blow your mind. We were able to redose this over and over, and so what we did is we did both intranasal and injectable gene therapy because we want to create the first gene therapy that people with neurodegenerative disease can do at home. So if they're filling a slip and they need more gene therapy, they could actually use it right at home. And it has very low immunogenicity, as you could see by it being in everyone's body without a subsequent effect. It has its way of getting around. It's got its own genes that basically shield it from the immune system. So we published this paper in PNAS in 2022. And essentially, I guess I didn't put the slides, what happened to the mice. Maybe that's boring to this audience anyway, but it was fabulous. They did well and they lived longer. And what I'll show you here is the mice are on the top line, and then on the bottom line is how that might affect humans. So our untreated mice, they die at about 28 months. But the treated mice in the TERT, the telomerase reverse transcriptase, again, lengthening the telomeres at the caps of the ends of the chromosomes, go on for over 40 months. And the mice with the follistatin, just increasing their muscle mass, go on for about 38. And if that was something that you wanted to look at, and if it went straight across the board to humans, it should be better with humans, but if it only went straight across the board, just telomerase reverse transcriptase could get you over 110 years, which would certainly get you to the next therapies that we're building that would help you even live longer and healthier. And that is the equivalent if you were only going to live to about 78. But if you took follistatin, you still would live to be over 100 years old. So not bad. And we're combining these therapies, which I think is really important because we're looking for the super wave, right? You have the TERT, you have the follistatin, but if you put them together, we're looking to bunch them up and get more. So what we're talking about here is lifespan and health span. So let's say everyone here is going to live to be about 83. 20 to 30% of that time could be in very, very poor health, declining health certainly, and limitations. With regenerative medicine, we're looking at taking that health span and driving it all the way past 83 and out, hopefully, as far as you want to go, as long as life is meaningful. So now let's get down to the most difficult part of the conversation is price. Because the many people out there that might have heard about gene therapy, probably everyone knows that it's the most expensive medicine on the planet. If your child, your baby, was just born today and had spinal muscular atrophy, the cost for the curative treatment, the treatment that would actually make it so that they could live and wouldn't die in the next 6 weeks, is $5 million. We have a child that we're trying to help raise money for right now who's got Duchenne's muscular dystrophy. He's been approved for a trial in the United States, actually an approved drug, and it's 3.2 million euros. So why do we do that to ourselves? Well, when you treat a monogenic disease, you have very few people in the population that have the disease, and people want to get their money back from putting it into research, I guess, because we started on a different end of the spectrum. We started with really rare monogenic diseases, meaning very few people have them, and they're a single gene mutation. So where there's just one gene that's known to replace, and gene therapy works great for it. But when you're making a gene therapy for very few people, the costs add up. But if we look at aging-associated non-communicable diseases, we look at a complete radical shift in the price of gene therapy. We can actually make it affordable. When we do an investigator-initiated clinical study, for instance, offshore, we get the price down significantly, and it can go way farther down than this by scale. If you have a rare eye disorder, there is a gene therapy for that now in the United States, but it's $450,000 per eye, or you lose your eyesight. In an investigator-initiated clinical study, we could do it for $75,000. If we had 100 patients, we could do it for $7,000. If you want a whole body infusion for spinal muscular atrophy, you're looking at $5 million. But if you go to an investigator-initiated clinical study, you're looking at $350,000. And again, if you had 100 or 1,000 patients, you're starting to look at affordable treatments. And because this is the biggest medical unmet need, aging-associated diseases, we're looking at the first $20,000 therapies coming up that are actually scientifically based and not, temporary type technologies. So how do we keep this from happening? Because this keeps happening. We keep curing mice, but people who need these drugs are not getting access. Today, over 110,000 people are dying as we're sitting here enjoying a conference. That didn't sit very well with me, so we started to look for partners, licensing partners who could get these drugs out to the world. We have a licensing partner in China. They're called Future Health. They're amazing. They're actually advancing our work in CMV. The image here shows our CMV actually infecting a macaque monkey, and this is a human CMV, which is important. Each species has their own version. And so they're showing that we can actually not only do it, but we could successfully transfect genes, and so they're going into a non-human primate study. It's already started, but the monkeys won't be treated for another several weeks, and I'm a no-kill person, so these monkeys can never be killed, so they're going to go on to live as long as they possibly can, and they'll be part of a lifespan study. They're amazingly well published, and the CEO of this company actually has one drug through the US FDA and another one about to be approved, I believe, in HIV. Unlimited Bio, these guys are wild and fun. They're from Russia, and they work out of Roatan, Honduras. It's an island. If you haven't heard of it, it's been in the news all over the place. They've opened up regulations for people accessing new medicine, and they have started their work in peripheral neuropathy, but they're bringing our gene therapies online, and we're very excited about that. Integrative Health Systems has actually been using our technology since maybe 2018. They've treated over 300 patients. probably more. No major adverse events. We're not seeing all of the things that we see when a regulatory system gives you approval to do whatever. These are safe doses of technology. That's why redosing was very important. We have positive impact on function and energy. The reviews that we see from this company are exceptional. I was just sent one about a week ago. And to see patients so happy with this is really moving me. And then with all of our licensing deals, they have to deliver on the data. So people can't just go use the technology. They have to deliver on the data, and that's what brings the valuation of our company up, because we have 53 full follow-up patient data through that company. Now we're going to get into something that we sort of touched on earlier today, which is cell technology. So RegenCell is our 4th licensing partner. They'll be opening in Dubai. They're already in Costa Rica, and they'll be going to the Bahamas as well. So you know the Bahamas just signed into law that gene and cell technology can be used there. They are specifically focused on stem cells, and stem cells, much like telomeres, are sort of a ticking time bomb in our body. So if you think about an infant, let's say, has 100% stem cells, because these cells are going to build all the tissues in your body. They're going to make you an adult, and that takes a lot of cellular divisions. By the time you're 18 years old, you have 40%, but let's jump over to 60. You only have 5% of your stem cells left. So even if we, do a lot of things to your body, if you can't actually regenerate your body, you're in a lot of trouble. A lot of people are looking at things called senolytics to get rid of old, what's called senescent cells, cells that are just holding the line that basically can't replicate anymore, and we see them in our skin and in our organs and all the way through us. But the thing is one of the reasons we're such a long-lived species is because of senescent cells, because our stem cells are almost fully depleted by the time we're 60, but we can go on to be 100. And that's because these old senescent cells are holding the line, so be careful about your senolytics. This company has treated over 1,500 patients. They have an 82% success rate and a very high happiness score. What we're going to do with them is revolutionary. We are now taking people's stem cells. We were talking about it earlier. We were talking about how young do I have to be to give my cells? Well, what if you didn't? We can reprogram your cells. This company has 9 patents on cellular reprogramming. One of the owners actually works with David Sinclair in Harvard. We can reprogram your stem cells to look young. And then guess what? Why did I step in? Because then we're going to lengthen the telomeres, and we're going to put back your own cells into your body so that you have the stem cells like you did when you're an infant. And so they have long telomeres and they can divide. And we can also do things like add cellular function capacities like cognitive benefits or muscle mass or metabolic benefits or repair benefits. So that's kind of cool. So how do we get this affordable for everyone? I work 1/3 of my time in regulations. I have a plan called Best Choice Medicine. I've worked in a lot of countries, and we don't talk about it because countries adopt their own laws. But I help countries sort out their laws and how to get patients access because it's the most ethical thing to do. We need to cure a lot of people, and we need to get them healthy. So this is a plan that has actually worked globally to optimize the use of medicine for patients. Of course, we hope to do it in the United States. I have the funniest list of emails. I did my thesis actually on regulation, so I have a published paper and everything. I email the White House every 4 years, and I have all these emails with the responses that are actually kind of close to healthcare but have nothing to do with what I said. Nobody's reading those emails, sadly. But other companies and countries are, and so we've got companies now streamlining into locations where they can do these therapies, and countries going online that are going to make a lot of money by doing the right thing for patients. And then this slide is essentially like, who do you want to be as you age? Do you want to be like Mick Jagger and totally rocking it? Or do you want to do a little La Bamba? That's okay, but either way, we want you to live a long time and happy and healthy. And I want to give a word of warning before I end my talk, because I know that these are big ideas. And for some people, the idea of a GMO has been very politicized. It's been weaponized against you. I'll say something very strong here, and this can be proved by science and by any biologists and scientists out there. Everything you eat is genetically modified. Nothing that we eat anymore is in the state that it was when it was first went into agriculture. The way they used to do it was Frankenscience. They'd splice two things together. Then they started radiation, just bombarding, and we didn't even know what we were getting, but maybe better, bigger fruit. Then they started genetically modifying it, and it is the most tested food in the world. But I don't care if you want to eat it or not. That's up to you. It's a way to feed the world, but that might not be of your interest. But you becoming genetically modified will define our species. It will define how long we live and if we actually survive extinction. As the planet is changing and radical changes are happening all around us, it's imperative that we who look at the world and can describe its beauty, do as much as we can to make it a better place and to stay and live, and at least, even if you don't care, leave it a better world for your children. Do not leave the same diseases that you die from for them, because our past generations didn't leave those for us. And so this says, he who rejects change is the architect of decay. The only human institution which rejects progress is the cemetery. Thank you. Thanks. Do you want me to?
Yeah. Okay. No, take your seat. Take your seat. We have a few minutes.
I'm not kicked out now.
No. Perfect. Thank you so much. So this is really impressive, and you really touched me. You know, I'm 12 years ago, maybe 13 years ago, I did a charity project for the EB kids. So it's epidermolysis bullosa. In Germany, we call them Schmetterlingskinder, so butterfly kids. And back then, there was, for my knowledge at least, no therapy, and we raised, I think, 400k euros and to help them, but there was no final help, of course. So that's why. I learned now it's possible, and this is great. But back to the talk. Do you sell this to wealthy people right now, right? Did I got this right? Oh, not you, but your licensing partners.
Yeah, it is expensive technology. When we can get nonprofits to pay for cohorts to go through, you can see we do that. We've published on that. And we're bringing on a new nonprofit now that will help actually fund these studies. But vastly, yes, the technology is for the wealthy.
Yeah. So what is the, and you said you're working 30% of your time on regulation. Yep. What is holding us as society, as the world, back to use this? What challenges do you have to overcome to come to the point when you say, hey, it's for everybody?
Well, I think that, a lot of it is bureaucracy, obviously. We wrote a whole bunch of laws to keep things from happening, but what they did is they kept a few companies really safe. The US FDA, for instance, it is there to make safe drugs for humans, but it's past the 10 most dangerous drugs in the world, and more are coming. So the FDA was vastly set up by big pharmacy. They lobby it constantly with more money than most countries have for their military. And they've made it grossly expensive, very difficult to get in, and there's a requirement of animal data that's not even predictive of human outcome. So in order to unravel this, we need patients to really demand access, and we need new routes of communication. And so that's what we do is with Best Choice Medicine, we step in if a country is interested in how do I actually leapfrog old technology and go for new technology that actually requires less instrumentation. And then we create an ethical plan for them to do that. So there's science boards, there's ethics boards, there's rigorous oversight, but it moves at a pace that is decades faster than these big, I mean, look, the regulatory system was made to make safe drugs for you, but now more people are dying that should have access to better drugs, and the better drugs just can't get in.
But you said, or you're talking about the regulatory system in US, and probably it's
and the
same,
EU.
same in EU,
Yeah,
of course in Europe, but other countries pick this up, and it's just a cheap flight to go to China and take a more expensive treatment. So what would you say, what will be the tipping point? The tipping point when US and Europe have to open up for this technology?
Well, I think that it depends on who's in control. So if they start to see this as a big gap in which the countries are losing money, again, we usually come down to financials instead of doing things for the right reasons. And sadly, typically you have to cut into somebody's budget for them to understand the interest point. I think that especially when providers like insurance companies, in the US we have private insurance, it's very expensive. When they start supporting people going offshore for technologies that are cheaper than onshore options, then I think you'll certainly, if not by then, you will see the switch.
Yeah, you mentioned in a short sentence that if you do this, so it would be. I think that the example was it was 75K, but if you do this for 100, then it's 7K. So would that be an idea to come to you with a group of people, bunch of people, and then it's cheaper today already?
Yeah, absolutely. We've even encouraged companies to put together what's called buyers clubs. So if they have patients that are going through, they have 3 or 4 patients going through, they contact all the other companies and they say, we're putting in an order. And then the other companies, everyone gets to buy in at a lower cost, which makes a more affordable therapy for the patients.
Mm-hmm. Mm-hmm. Interesting. Let's come back to my stupid questions. So Jose said in a few years he want to be 25. You said, or you want to look like 25. Is it something you can see? So turn them younger. So are you? Of course you look fantastic, but maybe you looked fantastic 10 years ago also. So can you see it in your face that it's working?
Yeah, a lot of people say that you can, and I can see it in the people who have tried it through the companies. But in order to actually get Jose back to 25, we need to treat all of the hallmarks of aging. Yeah. And so we're not able to do that yet. So I still have cellular processes that are running. I've got long telomeres in my T lymphocytes. That doesn't mean they're long in my entire body. We have still a lot of things to solve. But being there and being part of it and making it happen is, this is definitely the place to be. So can we get Jose back there? If we look at a cell in a dish, we can reverse its aging all the way to embryonic. Mm-hmm. That is scientifically proven. They can do it in a high school now. Mm-hmm. Now, with partial reprogramming, we can put it all the way back to youthful expression, adult expression. So that's totally doable. Lengthening the telomeres, though, is separate from that. So that's a second process that we have to do. But we can make a cell look like an embryonic cell of you from an 80-year-old person. So can we do it? Yes, but doing it in a human body is an engineering feat, and that's the goal of the company.
Yeah. Me, myself, I promised my kids in a debate we had, in a conversation we had, that I will try to become 120 years, because I told them probably your generation will be possible to get to become very old, and since this moment I'm confusing myself with the thoughts how to get there?
Well, I'm older than you, so
What would be your advice to me? So of course, I'm still not a biohacker. I'm still not deep in technology, in these technologies. What should I do?
for the average person, I don't think you're the average person, but the best thing to do is to take care of yourself in the middle life to get the most out of life. So don't smoke and don't drink. I showed the graph there. So there are some things you shouldn't do, and you can get more. But since you're not the typical person, I personally would start doing gene therapies.
How to start this?
Contact a company, talk to a medical doctor. These are US doctors. See what they think is right for you, what you might need, have all of your biomarkers taken, qualify for it, and then participate and probably start with the technologies that are the most well-vetted, like follistatin. But next up would be probably telomerase reverse transcriptase if you want to actually make sure that you live that long, because so there's many ways to measure biological aging. One is telomeres. Your telomeres, depending on your lifestyle and the stress that you've had, might be in a varying length of shortness. So if they're really short, you would want to maybe do that first.
I see. I call you.
Okay.
Let's come back to the futuristic question. So you said in one sentence you said you can live, if you use this in the future, you can live as long life is meaningful for you. So does this mean that death, or that it will be a conscious decision of people to die in the future?
I imagine it will be. I mean, either an accident will happen or a new infectious disease will come around. You know, it could be that we change back to the first graph that we saw in the 1600s, that, you know, infectious disease mutates so fast that that's what takes out most of the population. But the population in that graph were probably in their 30s. Yeah. The population in the future graph might be in their hundreds.
Yeah. Jose already mentioned one argument, and the argument, this is what I also hear sometimes from people. They say life is interesting and thrilling because it has an end, and if you take the end away, then maybe you get, they say, maybe you get lazy or unmotivated or whatever. What is your take on this?
Actually, we kind of see the opposite. So there's papers out on what's called mortality priming, and we know what happens to people psychologically when they know that they're going to die, and their world shrinks. They start stockpiling their assets, they meet less people, and they become more insular. We know that young people are the opposite. They share, they give, they have a wide network, and we would expect that that's what we would see. So mortality priming is something towards the end of life, and it's because it's a conditioning. You're living with a condition now. You know, you might be halfway through, if you're lucky, not halfway through a natural lifespan, but you know it. You spend a lot of time trying not to think about it, but you know it. And that actually affects us. And it's scientifically proven that it does.
So what does this mean? So how will be, if we get older and older and older, how people will reshape the planning of their life? So is it just they live their youth longer, or will there be completely new phases we have to explore? What do you think?
Well, I think we have to look at history. You know, we used to live a very short time, and when we lived longer, it basically marked the Industrial Revolution. So lifespan marked huge progress in the world. So it's very likely that we'll put our heads down and we'll want to make sure that the planet is, we live in a cell. So there's trillions of cells in our body, but the health of the one cell that we live in is massively important. And when you think that you might live for hundreds of years, you're probably going to take that more seriously. And so there probably will be a mix of work and play. And one thing that we'll see is on the graph of eating versus earning that you saw, you know, by the time we actually have enough resources to go take that super vacation and go do that, you know, that thing that we've planned all of our life to do, we're often in not good health. I was speaking in India recently, and, you know, I made a comment that all the tourists I saw were old and overweight, and they were having a hard time getting around. And I was thinking, how long did they plan for this in their life and the money to actually do this trip? So, you know, we would have the ability to expand into getting a lot more done. Probably we'll have another complete, even bigger revolution. If you look at the history of humans, we haven't lived that long, and we seem to have a meme inside us. And I'm going to really challenge you here, okay? We have a meme running inside us. There's like an algorithm. We're building something, okay? And society has done a lot to try to repress and hold down what we're building. Biology is moving at breakneck speed and has been for decades. The things that we could have done are well past us, but we can still reach for them now. And what we're doing in technology, in computing, and AI, things that were held back due to, you know, limits and money, and only certain companies can get access to certain things, and now only certain countries can get access to certain chips, has slowed us down as well. We're about to find out what we're building, because we see it through the entire meme, meaning this unconscious memory of humans. So we have our genes, and we have the ideas. And as Jose Cudero pointed out, the story of Gilgamesh already tells the story of extended lifespan. And we see that throughout Egypt, and we see this building of things that is immense. And I think that we're about to find out what we're building.
Yeah. Great.
So I think we should try to live to see what that is, and we should definitely fight for our biological relevance in it, because we are not just the builders, we should be the owners of it. And in order to do that, we need to get ahead biologically.
Final question, asking for my friends who are investors here. What would be the, if you look at this from the investment perspective, what would be the technology or your area of search to look for new startups you can invest in your field?
So if you're looking at the gene therapy space, you want to go with companies like us, not to toot my own horn, but we have a platform. So with CMV, we can build anything, and we can't be locked out of technology because it's a delivery system. So you want a company that's not now just looking at one gene or one disease endpoint. We can actually build you almost anything. Even people with monogenic disease reach out to us, and we'll build gene therapies for crisis cases. So that's one thing that you would want to look for. All of our partners are amazing, so you want to look for companies who have found a way to actually make money legally and help patients. So number one, you should get into biotechnology because you want to do it for ethical reasons, and the most ethical reason is the patient at the end of the day. But these companies are already generating revenues. And so when we're looking at the roadmap of countries bringing online these new regulations, we've seen for the first time companies who can afford funding their own clinical trials in the EU or the USA. That was never seen before. You know, it was always investor money, investor money, investor money. So find these really agile companies who can make money for you while they work.
Yeah. Good advice. Very final question. When you live long and longer, do you have a plan? Do you plan the end of your life? Or do you have a number? Or
well, you have to realize when I did the gene therapies in 2015, it was to save children. So my story had nothing to do with living a long time. After I did the second round of gene therapies and survived that as well, and showed that we could actually redose it and that I was getting healthier and healthier, I started getting really excited about the future. So I went from kind of like a public burning, like, how dare we sit on all this technology while our kids die, to I think we can actually do this. So the press about me probably was very similar in my head. I was like, God, what are we doing? Hopefully we can do this, and damn the regulations. And then now I'm like, I think we could pull this off. And so now, as long as I'm feeling healthy and happy and enjoying time with my kids and my family and my friends and having a growing network, I want to live. If I die doing this, I'm okay with that because it's been my choice.
Yeah.
And my kids will tell you I don't do anything I don't want to do.
Great. But I was asking because in our next slot we are talking about the possibility to get to get kids and in the age of maybe 70 or 80 or with a new technology. Would this be interesting for you?
Oh, absolutely. I love kids. I'll steal everyone's kids. I literally, if there's a baby in the room, I have it, and they're like, wait. No. Yeah, absolutely. I think that people should have the right to do that. And now even David Sinclair was just saying the other day, we can take your skin cells and make an egg and sperm. Yeah. So literally, even if a woman didn't have eggs left, let's say there's someone in the audience at 75 and she rejuvenates so that she's biologically younger, but she doesn't have eggs because that's something that we don't know how to restore yet. Yeah. She could actually have all the eggs that she wanted just from a little scrape of her own skin. And I think we should really enjoy the children. As my children get older, we should really enjoy the children. They bring so much warmth and love and life. And when you bring these big ideas to them, they don't take it hard like people who are already stuck in their mindsets. They take it very easy, and we should learn from them. So having more kids around is great.
This connects perfectly to the next session. Thank you, Liz. Thank you.
Thank you.